Hi guys, my name is Audrey and I'm a second year PA student, and today I wanted to talk about how scribing prepared me for PA school. So if you want to learn more, please keep watching. I also wanted to point out that scribing isn't the only job that you can have before you start a PA program, or if you're thinking to apply to any medical program out there. Scribing is just something that I did, and I saw that it benefited me an immense amount once I already started my program. So not everyone's gonna have the same experience, but I wanted to make this video to talk about what I experienced and things that I learned during working as a scribe that benefited me once I was already in the program. So the first thing I want to talk about was medical terminology. I know when I applied for my scribing position back in 2016, they had us take like a rigorous course of medical terminology for a whole month. So working where I worked as a scribe, they had us do like classroom training, and then they had us on the floor training as in a clinic or a hospital. So what we had to do for about a month, we went to classes in a remote classroom where we would learn medical terminology, vocabulary, and how to chart. They also taught us how to type in procedures and things of that nature, and like NIH scores for strokes. So we had to pass that before we could even practice like on the floor training. So I think that really helped me, because that in monthly training really opened the door to new terminology that I hadn't heard about. But it's not all inclusive, so only what they teach you in that month is not only the only medical terminology you should know. It's like the basic foundation of the medical terminology that you should like already know once you start scribing. But once I got in there, once I already scribed, I scribed for 3 years, and I learned so many words, even words that they didn't even show us in our training course, because it's just impossible to know every single thing in that month that they train you for. But they do their best, and they do a great job in teaching you as much as they can. But I learned so much that once I started the PA program, I already knew what hematemesis was, hematochezia. So those are words that I already knew, and I didn't have to, I guess, like spend that extra hour studying for those words, because I kind of already knew. So I felt like that was a good benefit for me, just because some of the vignette, they have a lot of that vocabulary, so I already kind of knew that terminology. So I felt like that gave me a good advantage, and I didn't have to spend so much time studying new vocabulary. Something else that I gained from scribing was how to interview a patient. Now, I don't want to say that I know how to interview a patient 100%, but after watching physicians, mid-level providers, like NPs that I scribe for, PAs that I scribe for, and my attending doctor that I scribe for, I kind of started to see how they would approach the patient. How would they start the conversation? If we have someone there that is there maybe for something a little bit more private or a little embarrassing to talk about, how would they break the ice? How would they build that rapport with the patient? So seeing that over and over and over for many years, I feel like that gave me the confidence to not be so shy, or not struggle so much with, I guess, practicing how to interview a patient, because I had seen it for so many years that I was excited. I wanted to be in their shoes and be like, okay, now it's my turn to finally experience how can I interview this patient to get them feeling better, to understand what they're trying to tell me, and to make them feel comfortable. So seeing them do that for so many years in many different situations, maybe with a trauma, something a little more private, with patients that come very often, with patients that don't come very often, many different kinds of variety of patients that are out there that we're all going to experience hopefully one day as providers. I feel like scribing let me see how you do that. How do you, when you don't say certain things, when you should ask certain things. So watching them interview patients over and over and breaking that ice, I feel like watching them do that really prepared me for my patient encounter course. And now that I'm a second year clinical year student, for my OSCEs, when we're doing a patient interviewing and how to take a history, I really feel like that really helped give me an advantage in that aspect as well, in the sense that I kind of saw them doing it so many years that I kind of had an idea of how to do it, I wasn't so blindsided by the whole experience. So going back to that month training that we had, I know as a scribe, they also do their best to teach us as much terminology as we can in that month, and they also do their best to teach us how to chart. So they give us like little vignettes or little stories of patients that come in, like for example, a 7-year-old Hispanic female reports to your clinic after having a lot of diarrhea or eating so much candy and fast food for the past days after having a road trip with her family. She has a past medical history of asthma, and she had a appendectomy a couple years back. So they would give us little stories like that. So they would show us how to put that information in the history. How would we put the information in the past medical history, like her asthma, and surgical history, like her appendectomy. So they would show us and train us how to put all that information in the proper organization. So once I was already on the floor in the ER where I worked, after doing that, like I said, for so many years, it was kind of like second nature. I was getting so confident in it and so fast at it that I could be doing multiple charts at a time. So I feel like that really gave me an advantage, or it made me, I don't like using the word advantage, but it made me feel comfortable in doing it. So now that I'm in my clinical year and we have to practice how to do a write-up or how to chart, I feel like, well, that was my job for 3 years in the local ER where I worked. So I excel in that, and I feel like really confident in doing that. So that's something else I didn't really have to, like, I guess, crack my head for. Not saying that it's really hard for everyone, but it's something that I kind of did for a long time. I worked in that. So it was kind of like second nature for me, like I said previously, to just document a patient's history. So scribing really prepared me for that as well. Now, I don't want to say that scribing is an opportunity for you to shadow, because it's not, and I don't think CASPA acknowledges that or counts that as shadowing. But as I worked there and scribing for nurse practitioners, PAs, and my attendings, my doctors, I did get to see how the PA works. I did get to see what they did, and I got to see how they would consult with each other or with other like doctors. Let's say they had like a stroke patient, how would they consult with a neurologist? Or if they had a stroke patient, how would they consult with a cardiologist? So I also got to see what they did, how would they communicate with others. So it was really, I guess, affirmative for me and validating for me, like, okay, this is what I want to do. Like, I know I want to be a PA, because I got to see for many years what they would do, what their job title entailed. So what does an ERPA do? So I got to see that for many years, and it's something really rewarding. And I'm glad I got to experience scribing in my local ER, so I could make the bonds that I did with the ones that do work there. And I got to learn a lot also in regards to watching them do procedures, because I had to document those procedures. So I got to see the realm of their world in the ER in my case. So that was also a plus to get to, I guess, shadow them, but not to use those for shadowing hours. So something that really affirmed me that, wow, this is something I really want to do, and I got to see day in and day out as a scribe. And lastly, I guess going off of my last tip or my comments was, I really got to see the teamwork ethic a PA revolves around with their providing, attending, or their doc that they work with in collaboration, along with the nurses, along with maybe the medical assistants, with the clerks, with the respiratory techs. I got to see how the PA works in a team-based environment. I got to see how the team operates together, and how the PA role is really crucial, and how the PA helps physicians see patients. And when they have questions, how do they ask the attending, or how do they ask their doctor? I got to see that interaction, and it was really cool, because I think about it and I'm like, okay, they tell us in class, like, you have to, if you have like an interesting case or something you're not sure about, you should always ask. But I'm like, how am I gonna just go up to the doctor and be like, oh, hi, doctor, whatsoever, I have this patient with this. Like, I'm thinking like, it's like presenting a case to them. So what do I say? How do I build that relationship with them? Which is something I believe once we're there, it'll be like second nature, but I got to see them do that, and it's something really rewarding. And it also gave me ideas as to how to do it, things to say, things not to say, how to present the case to them. And it was really something lovely to see, just to work in conjunction to help this patient just get better, to help them live a better quality of life. So just being able to see the teamwork ethic from the nurse working with the PA to the PA working with the doctor, with the neurologist, with the trauma surgeon if they come down because they have a trauma, just to see how the PA realm is and how big it is. It was something really neat to watch, and just further affirmation that this is something that I want. I can't wait to be in their shoes where I can help others and be in that space, you know. So yeah, those are the top 5 ways I believe scribing really prepared me for the PA program. Medical terminology was one of the big ones. Like I said, the teamwork ethic, how to chart, how to interview, how to present a case to your provider, your attending that you're working with in collaboration, how to interact with the nurses, how to consult with neurologists or make all these calls. How do you break the ice with shy patients? How do you talk about private matters when maybe the patient feels a little uncomfortable, but you have to talk about certain things to get to the root of the cause of why they're there? So all of that, being able to experience that, watch all of that happen, like I said, it really prepared me for the program and solidified why I wanted to be a PA. So I hope you guys enjoyed this video. Give it a thumbs up, comment down below, and don't forget to subscribe. I really hope those of you that are considering scribing really go out there with an open mind and are just as excited as I was when I started scribing. I'm telling you, you'll love it. It's a lot of hard work, but it will all be worth it. All the experience you gain, all the knowledge you gain after that, that just, like I said, further affirms your calling for being in the medical field, and just gets you to learn all this new content, all this terminology. That's just gonna make you a better candidate for your application and give you a head start in a lot of things once it comes to your program. So thank you so much for watching. Like I said, like and subscribe, and I'll see you guys next time.